For the health promotion presentation geared towards teaching our clients in the clinic, the topic I chose was drug and alcohol abuse. My name is Ashley Miller, School of Nursing at the University of East Texas A&M for the class Nurs5304, Health Promotion and Population Health with instructor Dr. Donna Calicote for November 20th, 2025. According to the United States National Survey, about 14.5% of people the age of 12 and older have been diagnosed with a substance use disorder in the past year. 10.2% from alcohol disorder and a 6.6% from illicit drug use, resulting in 107,543 overdose deaths in 2023. Over the next few slides, we will understand what substance abuse disorder is, which is also abbreviated as SUD, the various examples of substances used within our society, how the disorder is diagnosed, and how to treat it, prevent it, and promote abstinence in a drug-seeking world. What is substance abuse? Nearly 1 million adults over the age of 65 live with a substance use disorder, which is defined as those who have an addiction to a substance. According to NIH, addiction science is not a matter of no willpower or morals, but rather a complex disease requiring strong will and purpose to overcome that most people struggle with an early exposure to drugs leading to an increasing long-term dependency. The question that often goes through my head is, why do people take drugs? Is it to feel better, to go to a euphoric stage, for relaxation, improve focus, or does social pressure create a curiosity that becomes an addiction? The next few slides are some prime examples. First form of substance abuse is caffeine. Who would have thought caffeine would be abused? Let's face it, we all have been through school or long hours of work and require a pick-me-up for some energy to either make it through the shift or a class. Two major forms of caffeine are coffee and energy drinks. Depending on the type of drink determines the amount of caffeine affiliated. The safe amount of caffeine a day is 400 milligrams, which would be 2 to 3 cups of 12 ounces of coffee or 2 20-ounce Red Bulls, allowing the safe milligram consumption. What's your choice of caffeine? Alcohol is the most used drug among adults 65 and older, requiring at least a drink daily or weekly. Alcohol is the most prevalent of all substance abuse disorders. What does alcohol intake do to the body, also known as pharmacology? Alcohol is a CNS or central nervous system depressant, which excites the GABA receptors, causing overactivity of the central nervous system, creating the buzz feeling. When taking daily, the body gets used to the constant excitement to the GABA receptors. And if and when the daily alcohol intake stops, it will cause a withdrawal symptom because the central nervous system has to compensate for the lack of the excitement to the receptors. We usually see this in form of DTs, or delirium tremens. About 5% of people go through DTs and experience symptoms like insomnia, mild anxiety, headaches, diaphoresis or sweating, palpitations or the funny heart flutters, hallucinations, seeing things that aren't present, which hallucinations are the severe form of DTs, as well as seizures. Seizures are normally a tonic-clonic form, which causes the whole body to jerk uncontrollably. Drugs like benzodiazepines, phenobarbital, and propofol help reduce the seizure-like activity, which is going to be controlled in a hospital environment. Health risks of obtaining too much alcohol can cause an increased risk of diabetes, high blood sugar, congestive heart failure, liver and bone issues, as well as memory and mood disorders. These risks occur with various types of drinks consumed. Are the high in sugar, which would increase the risk of diabetes. Alcohol also makes one dehydrated, increasing the risk of kidney damage, which is ultimately could become kidney disease, therefore resulting in hypertension. Memory and mood disorders tend to follow with alcohol drinking due to the amount, as well as easily forget or even get upset or edgy when they haven't had a drink. Alcohol abuse is the 7th leading cause of death. Think about some family or friends you may know who depend on having a drink regularly. What health concerns or issues are they starting to deal with? Tobacco and nicotine. According to CDC, for every 8 out of 100 adults older than 65 smoke cigarettes. Smoking is the leading preventable cause of premature death in the United States. One form of tobacco consumption is smoking cigarettes, which is the most common form of tobacco use. According to NIH, if a smoker 65 years and older quits smoking, they will gain 2 to 3 years to their life expectancy. Vaping. Vaping is another form of tobacco or nicotine consumption. Vaping is very popular in today's world, mainly due to the various flavors offered, but also because of the ease of use. You can smoke inside without smelling up the house, you can hide it in a pocket, and you can take a puff in a restaurant without anybody knowing it. There is minimal research on the effects of the body. In East Texas, smokeless tobacco, or also known as snus, chewing tobacco, dip, or dissolvables, are extremely common. The dangers of smokeless tobacco are an increased risk of mouth, pancreas, and esophageal cancer, as well as teeth problems. The biggest risk of smoking tobacco is COPD, chronic obstructive pulmonary disease, which ultimately causes difficulty breathing, requiring oxygen or daily inhalers to be able to give some relief just to catch their breath. Cancer of the lungs is also an increased risk with smoking tobacco. Prescription medications. As we age, chronic conditions occur requiring prescribed medications to manage the symptoms. However, some abuse, or they don't follow the order on how to take it, becomes a problem and an addiction. According to Healthy People 2030, 5.2% of people the age of 12 and older misused prescriptions over a 12-month period in 2021. Various types of oral prescriptions that are misused are morphine, the oral form, codeine, oxycodone, hydrocodone, fentanyl in the oral form, tramadol, and methadone. These prescriptions are mainly used for pain control. With increase of surgeries and injuries, more and more drugs are being prescribed. However, due to the fentanyl crisis, more and more physicians are being held accountable for the amount of prescriptions given to help prevent addiction. What do these prescriptions do within the body? It activates the neurotransmitter receptors in the brain, which is in both the central nervous system and the peripheral nervous system, causing a relief in pain or discomfort felt. Fentanyl overdose has increased between 2015 and 2022 to an estimated 76,000 deaths. What and how do those on prescription drugs act or show? They normally show a decreased ability to breathe normally, euphoria, or that they appear to be on some kind of high, constriction of the pupils in their eyes, constipation due to the side effect of the pain medications, slurred speech, and sometimes illicit drug use to reach the euphoria that no longer is present with just the prescription medications alone. Marijuana. On the streets, people call it weed, cannabis, or hashish. Marijuana is either grown from a natural plant or it can be made through a synthetic process, which is usually compounded, increasing the risk for toxicity. Marijuana is the fourth commonly known psychoactive substance used among young adults the age of 18 to 25. What is a psychoactive substance? A substance that affects the central nervous system, whether excites, depresses, or causes hallucinations, and even relieves pain. Marijuana is considered a Schedule I drug and was originally designed for medical and scientific purposes. However, it is now legal in 39 states medically and 24 states recreationally. You can either smoke, vape, use a blunt, or take marijuana orally. Some may combine with other drugs like alcohol, tobacco, pain meds, and other stimulants to create a larger effect. Taking marijuana alone has a minimal risk for death. However, when combined with other substances previously mentioned, can increase the possibility of accidents and even death. Some benefits noted from marijuana use is in the neurological disorders, like the reduction of muscle spasms with people with multiple sclerosis, in Alzheimer's disease, and even decreases the intraocular pressure with those that have glaucoma. Cocaine. Cocaine is another drug from a plant called tropane ester alkaloid leaves, which is from a coca plant. It is estimated about 5.8 million people from the ages of 15 to 64 use cocaine daily. Two common forms of cocaine are presented. They're either a base, or it's called a leaf, that is also known as crack or freebase, which is mainly taken via smoke or inhalation. The second form is salt, which is dissolved to be injected into the veins or snorted through the nose. Upon entering the bloodstream, it is rapidly absorbed, enhancing the neurotransmitters in the brain in both the central and the peripheral nervous system, creating a hallucinogenic effect, allowing the body to escape what is going on in the brain and to relax. Various forms of administration routes are available and depends on the person's preference. Which method is used? If smoked or taken into the veins, the hallucinogenic effects last 15 to 30 minutes and is considered the quickest onset. If snorted or taken orally, which is considered the slowest onset, usually taking up to 90 minutes to take effect and feel the hallucinogenic effects. Lastly, cocaine can be taken rectally, known as plugging or booty bumping, which has a decent absorption time when it breaks down and gets into the bloodstream. What do we see when people are on cocaine? With a recent hit or injection or smoking of cocaine, euphoria is immediate. The high looks and feeling, looking dazed and off in another world. Because the nervous system has been affected, the heart rate increases, pinpoint pupils, restlessness where they can't sit still or pacing the room, panic attacks as the central nervous system calms back down, skin lesions around the areas of injection sites or where they have scratched an area out of nervousness, increased cravings in particular foods or drinks, acacia, which is also known as crack dancers, wildly dancing uncontrollably with no intention to stop, bucolingual dyskinesia, or also known as twisted mouth, where the mouth is open and the tongue is slightly to the side, tardive dyskinesia, or involuntary movements of the facial features like facial grimacing, rapid eye blinking, repetitive chewing. As one comes off the cocaine, suicide ideation and attempts are at risk, and the overall safety of the patient is of concern. Heroin. Heroin is a derivative of morphine and is taken via injection into the veins. Heroin's half-life is 30 minutes and can last up to 4 to 5 hours. What is a half-life of a drug? Every drug has a half-life, meaning the amount of time it takes for the drug in the body to reduce to half the initial amount originally injected into the body, which is then excreted, and in this case is through the liver. Heroin users will be noted by their track marks, or a damaged nasal septum from snorting, which also creates watery eyes or muscle twitching or drowsiness. Most heroin users use 2 to 6 times a day, if able to afford that frequency. Some common street names for heroin is dope, horse, smack, China white, junk, or tar. Heroin has increased health risks due to main form of use is injection into the vein, increasing HIV and both hepatitis B and C. Methamphetamines. Another example of a common psychostimulant which releases and blocks the reuptake of neurotransmitters in the brain like dopamine, norepinephrine, and serotonin, which all cause a hallucinogenic effect on the body. Those who take methamphetamines commonly smoke or snort, but can also inject into the veins, presenting with a higher impulsivity and activities, increasing the risk of injury to self or others. Meth users experience an increase in libido, euphoria, and even weight loss. The half-life of methamphetamines is 9 to 13 hours. What do people look like when on methamphetamines? Tooth decay and dry mouth is a very common presentation of someone on methamphetamines. Clinically, will present with an arrhythmia, which is an irregular heart rate. Some may have had heart attacks, strokes, or even long-term heart conditions called cardiomyopathy. Dilated pupils with a recent hit of the drug, pulmonary hypertension from smoking substances, kidney dysfunction from the recurrent drug use, which will eventually lead to organ failure. An increased diagnosis of syphilis due to the increased libido while patients have been on methamphetamines. The picture is of the brain showing the various areas that are excited while on methamphetamines. When someone has recently used methamphetamines, this picture really shows why they are so impulsive, with so much electrical activity going in the various regions of the brain. Substance abuse as a whole has a variety of routes and methods to obtain the desired effects. First, orally, when drinking alcohol or taking a pill of some form. Smoking is another popular route, whether tobacco or an illicit drug mentioned earlier. Intranasal is either snorting or sniffing. Subcutaneous is when the drug is inserted under the skin into the subcutaneous layer, creating a term called skin popping, which can lead to cellulitis or infection of the skin. Intramuscular injection, which is just into the muscle, is normally the quadricep or your leg muscle, or the deltoid, which is the upper arm muscle. Lastly, a common route is intravenous, or into the vein, which creates the quickest and effective route, though the side effects are higher due to direct injection into the bloodstream. Who is at risk for substance use and abuse? Those with family history of use and abuse. When growing up around people with the use or abuse of a substance, often finds it as a normal way of life, and therefore creating a curiosity to try and usually get addicted. Others with increased risk are those who have a social history of use, to maintain a persona, or even in today's world, the saying of keeping up with the Joneses. However, those with mental disorders like depression, bipolar, schizophrenic, anxiety, PTSD, and ADHD often take drugs to help cope with their current mental issues instead of seeking medical help to do it appropriately with current medications, instead of the use of substance abuse. Genes and environmental factors also increase the risk of abuse and use. Do you know someone who is at risk for substance use or abuse? General assessment and medical concerns not addressed previously. The best way to confirm drug use is through urine test. However, there are some specific blood tests that can give further details, like the exact amount in the bloodstream or even the half-life levels. With people using drugs, the biggest concern is their safety, including symptoms of drug use, but also withdrawal symptoms and the potential needs of a hospital or facility stay for a safe withdrawal process. How is substance abuse or use diagnosed? Most diagnosis occurs during the withdrawal period, depending on the specific drug and the last use of a drug to help with the timeline of a withdrawal period. Some examples are that alcohol use withdrawal symptoms start to occur within 6 hours of the last drink, or can last up to 96 hours. With heroin, after the initial hit, the withdrawal period begins pretty immediately because it's lipid-soluble substance that's breaking down quickly. As for cocaine, after about 30 to 90 minutes, the drug has hit the brain and will begin to seek more and begin to present withdrawal symptoms. Properly diagnosing someone involves the DSM-5-TR, which is the American Psychiatric Association Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision. The DSM-5 helps determine why the patient is consuming an unhealthy amount of a substance or a substance in general. Is there a mental disorder that is present? Take a quick glance at that diagnostics quick guide criteria in the picture to get an idea of what the diagnostic table looks like. How to treat, prevent abuse, and promote abstinence. Upon confirmation of the drug, whether it is through the urine, blood, sweat, or even a hair follicle, medical help can prescribe proper medication to help with withdrawal symptoms. Asking when they last used the drug will also help with the withdrawal timeline. If it was a recent use, and if so, how often is there normal? Do you have anyone concerned for you and your health while taking these substances? Have you ever been diagnosed with a psychological issue? Anyone who could relapse that has been through it before? Did it work or did it not work? After a thorough evaluation, apply the proper intervention like educating on abstinence and assist with joining appropriate groups for help. For example, like Alcoholics Anonymous. Will the person need to go to a specialty facility like rehab or a psychological facility to allow a safe and effective withdrawal process, as well as address the issue at hand to prevent reoccurrence? Ultimately, how do we teach and promote health without addiction when help is available to treat the symptoms appropriately? In conclusion, are people aware of how frequent and common drug use is in today's world? How many struggle with a form of addiction? How many are even in denial of an addiction? As a nurse practitioner, utilizing the diagnostic tools to help diagnose, promote abstinence, and treat the patients effectively. Assessing who is at risk, any underlying mental disorders, enabling success in a program or group. The biggest challenge is the patient may not want help or in denial of the issue, as well as not wanting to give up the high feeling or even the euphoria stage. Our job is to educate, promote health and wellness to a community with bringing awareness to an increasing pandemic of substance abuse. The following 3 slides are the references used throughout the presentation. Thank you for joining me in learning about drug and alcohol abuse.